Hi, my name is Ritesh Bawri. I'm an entrepreneur and also the father of two wonderful children. Interestingly, I'm also someone who's almost died 14 times in my life. From being in a near plane crash to being lost in a jungle, I've seen it all. 7 years ago, I experienced what was hopefully my last near-death experience. I just turned 40. I was diabetic, I was hypertensive, had always suffered from asthma, and I had acidity for at least 20 years. Thanks to the intervention of Professor Ravi Rajan, I was able to reverse all these conditions in 90 days. I was hooked. I had to learn more. Since then, I've read thousands of medical journals and hundreds of books. I've certified myself in physiology from the Harvard Medical School and in nutrition from the Tufts Medical School. I just had to understand what was happening in the human body. I've started Breathe Again, a platform dedicated to helping people live a very long and a very healthy life. We've been able to impact thousands of people, reverse lifestyle conditions. You know, the really interesting thing is that even the World Health Organization calls lifestyle diseases potentially reversible. Are we saying that if you just simply made some lifestyle changes, 7 of the top 10 reasons why we're dying could be reversed, or at least the risk could be reduced? To find out more, I put together the Ritesh Bawri Show, where we talk to experts and regular people, understand from them what's going on with their lives, and how all of us can live a very long and a very healthy life. Welcome to the show, the Ritesh Bawri Show. I'm really excited to welcome my good friend Rahil Shah to the show. You know, I'm someone who really believes in quantification, measurement, diagnosing the human body, because I think that truly gives you understanding what's happening. When you understand, you can prevent. And I think that's really what his company, NM Medical, is all about. Understanding the human body, diagnosing the human body, and then in many ways preventing diseases from occurring. Most of us end up going to a diagnostic center when we're sick, but I think his company has really pioneered going in, getting yourself checked, and in many ways preventing disease from occurring. So there's a lot to discuss, everything medical, everything diagnostic, the good and the bad. So welcome to the show, the Ritesh Bawri Show. So hi Rahil, really excited to have you here. Welcome to the show. While I was researching your company, one of the really fascinating things I discovered is that you all have almost pioneered preventive healthcare. In a world where typically people go to a diagnostic center when they're sick, you've actually made the whole experience pleasurable. So let's start there. What is preventive healthcare and why have you focused on that?
Sure. Thanks, Ritesh. Pleasure being here. Preventive healthcare is really the mantra that we follow at NM. And in fact, when we began in the early 2000s, we truly were the pioneer in preventive healthcare in the country. It wasn't a focus area for hospitals. It wasn't a focus area for diagnostic chains. But after we began, we saw a wave of adoption across all large healthcare providers. And today, preventive healthcare is available widely, or far more widely than it used to be a couple of decades back when we began. But the way we do it is still unique and different. Let's understand what preventive healthcare actually should entail. And there are many misconceptions around that. An ideal preventive health screening program must encapsulate all the disciplines of diagnostic testing, whether it be lab testing, imaging, consultations with specialists like cardiologists, physician, gynecologists for women, and so on. And increasingly, in recent times, genetic testing as well.
Sure.
And if you do any of these in isolation, you're really doing an incomplete preventive health check program. So when you're considering the adoption of preventive health care in your life or lifestyle, it's important to look at a place where you can get all of this done under one roof and then get a comprehensive assessment of your test results. So understanding what preventive healthcare should actually entail is the first step towards taking better control over your health.
Got it. But like for a lay person, like this whole notion of prevention, right, is still novel, is still unique. Could you just unpack that a little bit so that I understand what am I really preventing? And by diagnosing, how am I preventing them?
In fact, I would argue that even more than when we began, today, there's no better time to adopt preventive healthcare than today.
Okay.
Simply because based on the results of the health checks that we do, and I'll tell you what gets covered in that and what it means for anyone undergoing that. But based on these results, one can actually have personalized, actionable interventions that can prevent a major health disaster from taking place.
Okay.
Today, we live in a world of personalized medicine, predictive actions, and the modern era of the way medicine is practiced currently allows you to have timely interventions in a better way than you could ever before.
Got it.
An ideal preventive health check program should cover all your lifestyle diseases.
So type 2
diabetes, cardiac disease, liver disease, renal disease, obesity. It should accurately look at all the major organs in the body, like your lungs, your abdomen and pelvis, your heart, your bones, because osteoporosis or fragility of bones with age is becoming an increasing problem in India. So cancer across all spectrums, prostate cancer, particularly in males, and cervical cancer and breast cancer in females. If your health check program can even encapsulate these disciplines of disease, you're good to go. Now, based on these results of when you do all of these tests for these different diseases and the correlation of that with your medical history, your family history, one can make an informed decision on how to take control over any potential medical event that may occur and prevent it from happening, or control any medical condition that is uncovered during the preventive health checkup with timely medication, lifestyle modification, and so on. So when we're talking today increasingly about living longer and living healthier and improving quality of life, preventive healthcare allows you to do that, to ensure that as you age, you're not riddled with unknown sicknesses and disease that are hard to manage at that time.
Sure. So, it's really funny, but like from the experience I've had, people are afraid to get on a weighing scale because, the weighing scale tells me the truth, right, of where I'm at. From that perspective, to come to like a diagnostic center, get myself tested thoroughly, the risk of like discovering something. I think many people actually just want to live in ignorance. How do you overcome that? Like, what's the argument you would make that I would like you to make? Because I'm a firm believer of what you're saying. How can we convince people out there that, look, this is really good for you? You should test often, test frequently, and test early, right? How can you make that argument for them? Thank you for watching. Being connected to each other is easily one of the most powerful emotions a human being can feel. On that note, I have a very small request to make of you. Lots of you watch this channel, but not all of you subscribe to this channel. If you subscribe, you'll get notified of all the new episodes that we're going to be releasing very shortly. We've had some fascinating conversations with some amazing people who have so many powerful lessons to teach. So please do subscribe. If you subscribe to the channel, you will know about all the new episodes we're releasing. So please subscribe now.
Exactly right. I mean, there's a lot of fear of the unknown, and which is why people typically tend to put off getting a health check done. Even if it's scheduled for a particular day, you'll find a reason or an excuse not to get
come.
It done.
Exactly.
But that's changing a little bit. I think with greater social media awareness, word of mouth, we find that the general mindset towards adopting preventive healthcare and the fear psychosis that's around it is reducing over a period of time. So that's a good sign. But like I always tell people, imagine the peace of mind and the happiness you can get if you know, having undergone a health check, that there's really nothing significantly, that you need to be concerned about. That to me is the greatest value. Sometimes people also argue the reverse, that, I came for a health check, I spent all this time, I spent all the money and everything is normal. Yeah. So it was a waste. And we tell them, no, it's a great outcome. Absolutely. For you to know that everything is normal. And typically, if there's one of the features we provide also is an option to counsel with our physician or guest relation executives prior to signing up for a health check. And most of these sort of myths or queries or concerns are addressed at that point in time. So I don't subscribe to the mass promotion and selling of preventive health check or doing it around a fear psychosis like you sometimes see in advertising and marketing today in India. But having an informed conversation, either through your family physician or through any of our caregivers at our center, and understanding what tests are right for you at what stage of your life, and then what you will end up doing with those results, the option to come back and see one of our doctors to guide you through the results and assure you that things can be managed appropriately, usually gets people over the line.
Got it. Very interesting. So then my follow-up question is then when should I start? 10, 15, 20? Later than that? How frequently? Is there also a seasonality? Like, generally people you'll find starting to do their tests like the beginning of the year. Like, okay, let me get this year, in order. Is there merit to that, or does it not matter at all?
So we don't really see a seasonality for preventive healthcare, right? Like there is with diagnostics, when in the monsoon, for example, you'll see a spike in diagnostic testing. It's a great resolution, New Year resolution to have, to say, let me get it out of the way in the first month of the year so I know what to focus on for the rest of the year. Mm-hmm. But that's not necessary in our opinion. I think the more critical question is when you begin.
Sure.
And there's no clear answer to that. It varies depending on your family history, depending on any past medical conditions that you may have had growing up. But typically around somewhere between the age of 35 to 40 years is when we say a baseline preventive health check is an ideal way to start for an adult. We do offer adolescent and child testing as well, but we're trying increasingly to push that through schools and colleges so that there is a reliable medium that can be used to educate parents and children on what kind of testing is appropriate at that age.
Right.
We don't want someone to do more testing than what's necessary at that age in particular. So while adolescent testing programs exist and we offer packages for the same, for adults, I would typically recommend between 35 to 40 years. And the selection of tests or the selection of package is also age linked to some degree. So I wouldn't, for example, recommend a mammography test for a 35-year-old female unless she has a high genetic disposition to breast cancer, which means she has one or more first-degree relatives who have been diagnosed with breast cancer in her family. So again, it comes down to having a conversation with the healthcare provider where you're planning to go for your preventive health check and selecting the package that's appropriate for you, or driving it through your HR if your company is sponsoring a health check for you, or through your insurance company if the insurance company is providing a health check for you, where the service provider would have had a conversation with that appropriate authority to identify age-linked packages for different populations.
So let's talk about children first. Like, in your opinion, what should a child be testing for? Like, what are maybe 2 or 3 key tests that really matter?
Yeah, so typically we want to look at hemoglobin, we want to look at iron deficiency, we want to look at vitamin deficiency, and then healthy lungs and a healthy heart. And if we can add in an eye test for vision, that's always good. Most children would have a pediatrician that they go to for a physical examination, but that's another element where, short conversation with the child on general health parameters, followed by a physical examination, is always a good way to end the package. So keeping it basic, but covering all the essential areas for a healthy growing child.
Sure. Like, I've spoken about this before. I had vitamin deficiencies, so D and calcium, and my legs would ache all the time. And I didn't have any diagnostic center to go to tell me. So I just suffered my entire childhood. So I know I completely subscribe. I mean, maybe it's a smaller subset of testing, but I think you're right.
Sure.
Sometimes it's just good to know. But then, is this something you want to do annually?
Ideally for children or for all age groups?
Yeah, so let's just break it down both for children and then for...
So for children, I wouldn't do it annually.
Okay.
There's no need to do it annually. But once every few years, particularly as children move into adolescence and then into young adulthood, that's the way I would do it. At childhood, adolescence, and then young adulthood.
I'm so sorry, if you don't mind, for the benefit of those listening.
Yes.
So could we be more specific? Like what, 2, 3?
So I would say between 5 to 7 years.
Okay.
Then 7 to sort of 11, 12 in that age group.
Okay.
And then sort of the early teens, early to mid-teens.
Got it. And then you jump to 35.
And then I would jump to adulthood, unless you had a significant medical condition like vitamin D deficiency that was discovered, for example, which you could follow up more frequently.
Got it.
Right? For adults, an annual health check is the way to go. But again, not every test needs to be done annually. So there are some tests which you may want to assess for coronary artery disease, for example, or whole body cancer screening, for example, which don't need to be repeated so frequently. So a responsible service provider should look at your previous testing and guide you on what tests need to be repeated with what frequency. But at least as far as your routine immune system, cardiac blood test, liver, renal profiles go, a chest x-ray, ultrasound, maybe a treadmill test, and a 2D echo, followed by some consultations, is part of an annual health check. As you go beyond the age of 40, between 40 to 45, you would add in a mammogram for females and a DEXA bone densitometry scan for both males and females.
Interesting. So let's continue this conversation about diagnostic. Obviously, what you're describing is more metabolic testing, right? Testing my blood profile and so on and so forth. But obviously, people also suffer from other things, right? Knee pain, joint pains, back pains, etc., etc. Have you all thought about it? Do you see other people doing it, like testing for gait analysis, testing for VO2 max, testing for HRV, things like that? Is that a direction that you're going in, others are going in, or the world is going in?
Globally, yes. In India, we don't see adoption of that as much yet, and not with us either. The one thing what we have added in our programs that I think is immensely helpful is a whole body MRI scan.
Okay.
And that allows you to assess your brain, neck, spine, abdominal organs, lower limbs, joints. It can identify early aging with screening signs for dementia in the brain. It can look at any neck pathology, including early signs of any lesions. It can look at complete spinal pathology, giving you an accurate analysis of any back pain that you may be suffering from. It would look at all your joints, your abdomen, pelvis for any kidney stones, fibroids for women, pelvic masses. And we've done thousands of whole body MRIs. And we've had many unexpected findings that has potentially saved lives for a bunch of them. The direction we want to move in further to make that a more acceptable test for a wider population to do is to quantify some of these results.
Right.
Today, when we do a whole body MRI, it's a very subjective reporting based on the radiologist's interpretation of different things that we see in the body. The MRI scanners that we use are so sensitive that you will never do a whole body MRI scan and have zero findings. There will always be some small
Of course,
findings.
yeah, makes sense.
So putting those in context, trying to quantify results, giving actionable next steps is something that globally there's a lot of work that's happening in this space. There are whole body MRI companies in the US that are using AI in a big way to make this more sort of palpable to the end consumer and to the referring clinician. And it's a matter of time before that translates into our practice here as well. That to me is a significant differentiator in addition to the routine preventive health screening program that we do. Certainly, the other areas that you mentioned is something that we would want to add on as well. But today, consumer awareness and clinician awareness about those are relatively limited. So it's hard to convince people to sign up for those programs. The other thing that we do want to look at really, bringing on in a large way into preventive screening is sleep analysis.
Sure.
So there's so much research globally now on how sleep impacts our health in multiple different ways and how healthy sleep can really impact good health significantly. So typically you would do sleep apnea testing for symptomatic patients who snore, who don't get good sleep, who are always tired during the day. But we're kind of taking one step back and we're working with a company that's based out of Australia and now have a presence in India to bring that into our preventive screening practice and giving patients a very objective analysis of their sleep and what are the areas they need to focus on to improve the quality of that sleep.
That means regardless whether my sleep is bad or not, I'm
Yes.
still coming and getting myself tested.
As part of a health check program. Because a lot of times you wouldn't even know it. It's, you don't need to be acutely symptomatic to have sleeping issues. And picking it up at an early stage allows intervention. Again, very simple interventions that are now available to address that. So I think whole body MRI, sleep testing, and then the ability to take all of this and put it together in a comprehensive analysis. Again, that's easy for a layman to understand and follow up on year to year when they come back for their follow-up testing is really what will make that health check program that much more valuable or more useful.
Yeah, exactly. Pushing back on that MRI thing, there are no side effects.
No side effects. So I was going to add there as well that the nice part about a whole body MRI is that it's not a radiation emitting test. So when this whole body testing space started, it began with whole body CT scans.
Right.
But very quickly that went out of vogue because of the radiation challenges. And as much as with the modern era CT scanners, we've been able to bring down radiation to a bare minimum, why would you radiate even a little bit to a healthy patient?
Correct.
And therefore, whole body MR, completely safe in a magnetic field, no radiation, fairly quick with the newer generation scanners that use AI in a lot of the protocol acquisition, and very comfortable for the patient with the wide bore scanners that you get now.
Interesting. So let's say someone 35, 40 going in for an MRI is something you would very strongly recommend.
A whole body MR as a screening tool, certainly.
Interesting.
And again, like the coronary CT scan that I mentioned earlier, where one wouldn't need to follow up annually for a test like that. The whole body MR also probably doesn't need to be repeated every year because within a span of 12 months, you're not going to see
that
massive interval change in your health status when it necessitates doing a whole body scan.
Got it.
So based on the findings, we can define the frequency for follow-up. And again, that comes down to getting your tests done with a responsible service provider.
Very interesting. Which brings me to the next question, like something that's really baffled me always. Like prevention is so much better than, reversing or trying to reverse a disease. Why don't insurance companies actually promote this? Like it's like just to me seems like a no-brainer, right? If I prevent you from falling sick and dying, then my insurance risk goes down. So I would just ask everyone to get into preventive healthcare, do like a diagnostic screening and bring down my insurance cost. Well, what's the disconnect here from the industry point of view?
Sure, that's a great question and something that we've been waiting for to change as well. And I do believe it'll happen sooner rather than later. But there are a few challenges that have prevented earlier adoption of preventive screening by insurance companies. A, the penetration of health insurance in India itself is still quite small. And the greatest focus for these insurance companies is first trying to penetrate to a larger market, hit tier 2, hit tier 3, make sure that enough number of people are covered under health insurance in India. Obviously, sort of just like how when we are sick, we end up going to a healthcare facility and that becomes a burning issue as compared to prevention, which can be put off. For insurance companies as well, addressing the sickness population and finding a way to cover that cost and build models around that, balancing accessibility, coverage, and cost for these illness conditions itself has taken a lot of time and resources and effort. Now that they seem to have got that right, I don't know when you had an insurance claim process last, but I've had one done fairly recently for my family. And I found the process to be remarkably efficient compared to what it used to be a few years ago. So insurance companies have got that part of the cycle right. When patients need to be admitted for a medical condition, whether it be on a cashless or a reimbursement scheme, it's far less painful than what it used to be a few years ago.
Okay.
So now, naturally, I believe that a lot of their resources will move towards managing or incorporating preventive health. The challenge there, of course, is the dearth of dependable preventive healthcare service providers across the country. Anything that needs to be done by insurance companies obviously needs to be at a national level, needs to be available at tier 2 and tier 3 levels as well. And for them to tie up with diagnostic service providers that provide both lab and radiology, not just lab, do it in a way that's dependable, driven by quality, and is still reasonable in cost, just given the sheer number of health checks they would need to do, is a challenge. So we see that with our corporate health check testing as well. When we tie up with a company that has a presence across India, they find it really difficult to cover their employees who are in smaller cities, far-flung areas. Same challenge applies for insurance companies. So when they're able to figure this piece out, bring on enough dependable providers, I do think you'll see a change. Already from some insurance companies, we're being approached with pilot programs for bringing in preventive healthcare. So if those programs go well, I think it's a matter of time before the space explodes.
I mean, just think of the insurance, diagnostic, and then some sort of consulting advisory service.
Right.
That triage together, I think we'll just end up being so much more healthy.
And that third part is important as well.
Yeah.
For insurance companies to look at preventive healthcare data and again to make it actionable, where they know how to link that to premiums or the risk profile of that particular individual, is not easy. And you don't want that to be a subjective process. So bringing in the right algorithms or consulting partner that can make sense of all that preventive healthcare data and then allow them to build models around it is the other piece that they still need to kind of really put together.
Very interesting. Okay, let's change topics quickly. Let's talk about accuracy. So we talked about diagnostic, we talked about prevention, we talked about it being very useful, doing it annually, and so on and so forth. Clearly, one of the concerns that as a consumer I would have is, okay, getting myself tested. Like God knows what I'm going to get, right? Is this result going to be accurate? Then you juxtapose that with this issue of like costs. So, what used to cost 5,000 rupees, you have people coming and offering me for like 500 rupees. Naturally, in my head, I'm wondering like, what the hell, right? How can you do 500 and 5,000, have both of them coexist? So what's going on? What is accuracy? What does it mean to get accurate results? As a consumer, what should I be thinking?
There are two very important concepts when we look at diagnostics, whether in lab or in imaging, and they're accuracy and precision. You want your results to be reliable and accurate, but you also want to be able to reproduce them again and again, and then your process is correct. Unfortunately, in India, there are not a lot of accreditation standards that the consumer can rely on as a metric of quality. We do have accreditation in lab, we do have accreditation in imaging, but there's not enough awareness created for the consumer on the importance of using a lab that has at least that accreditation as a baseline. Okay. That should be the first goal. To educate both patients as well as consumers that unless you have this accreditation, which the most common one is NABL or NABH for imaging centers, unless this is in place, you shouldn't be considering going to that facility for your testing. The other piece, of course, is to, once you use a particular lab or a service provider, I would recommend sticking to that service provider because you will invariably, and sometimes we see these with our patients as well, but they'll get tested with us. For whatever reason, they'll test elsewhere after a few weeks and come back and compare results. And you'll never get like-for-like results. Some small differences in methodology, reference ranges, your fasting profile the day before, your exercise profile the day before will cause variation in results. So sticking to the same service provider over a period of time is one way to ensure that as you track your results and you see the trend analysis over a period of time, that is actually dependable for you. Of course, it doesn't solve for the problem that if you've gone in the first time for a preventive health check and suddenly an unexpected finding shows up, the first question that comes to your mind is, oh, how could this be?
Yeah,
I'm healthy, I don't feel sick, I don't feel fatigued. How could this finding show up, right? And a lot of diseases that we pick up at an early stage are relatively asymptomatic in nature. Typically, your follow-up would then be to go to a clinician who would then do a couple of confirmatory tests to understand how to manage this and confirm the results that were seen. And that typically will then give you the confidence that what was diagnosed was indeed correct. Sometimes we see people who will go and get tested at another place just to confirm the results.
Sure.
So that's the other way to do it. But that's where in this space, the brand recognition, the brand loyalty, years of being present in the market and offering a service actually has a lot of value.
Sure.
And therefore, when we see these wave of offerings that now come with centralized testing in one place and aggregation of samples from a wide geography to bring down cost, it typically doesn't really last for long. I mean, already we're seeing significant pushback on that model. and evolution of that model from those service providers into a more hub and spoke model with processing and provision of services closer to the site of where the patient resides or where the sample was collected. Because this is a place where space where small things can make a big difference in terms of the way your sample is
stored,
transported,
correct,
the way it's reported, the credentials of the person who's reporting the test, the experience of the person who's performing a test where you go to a center and get your test done. There are many variables. So while the centralized low-cost aggregator model has been tried, it typically doesn't seem to work for the educated tier 1, tier 2 market. And primarily, if anything, is creating a new market for testing that was not testing before, but are saying, hey, if it's just $500, why not give it a shot and do it? I have nothing to lose.
Exactly.
What we then see is if there's we see the reverse. So if there's a positive result that shows up in any of those tests, we see that patient coming to us and then doing a confirmatory test to see whether those results were reliable.
Got it. Like you've been very kind. You showed me your entire laboratory and the testing facilities, and it's all completely automated. There's no human intervention. Given that, one of the things I picked up from you was interpretation. So despite the fact that this whole thing is automated, when I'm getting a result, is there really some sort of an interpretation taking place and expertise around that?
Yeah, so there are 3 parts to getting a high quality test. There's a pre-analytical phase, an analytical phase, and a post-analytical phase.
Okay.
Whether we look at, lab or imaging, again, applies to both. The analytical phase in both disciplines is increasingly now becoming fully automated.
Okay.
It's ripe for disruption. You can use robotics like we have with the automation track. You can use AI to validate results. You can use AI to support the radiologist on particular findings that someone could potentially miss. You can use AI to structure reports in a way that's meaningful for the end consumer. Mm-hmm. But the pre-analytical and post-analytical phases still have some manual dependency. The pre-analytical in particular requires very careful monitoring of, for example, recording accurate patient history, like I said, transporting samples well, making sure once they get to the facility before they're processed, they're stored appropriately, they're centrifuged in an adequate period of time if they're lab samples. In the imaging domain, it would be making sure that prior results done at other facilities are obtained before you perform the scan. So the radiologist or the cardiologist is well informed on what to really focus on. And in the post-analytical phase, putting all of that together, the findings in context of the medical history of the patient is still dependent on a human being or an individual doing that.
Right.
So it's great to have the automation that we have. We know that creates great reproducibility and precision, what I spoke about in terms of being able to have every sample processed in an identical manner, sample after sample. Or when we do that in radiology and use some software assisted programs to make sure there's no deviation from one patient to another. But it still requires skill to make sure that sample or that patient is handled well, and then the result is released in the right context.
Got it.
And that human skill is not likely to be replaced anytime soon.
Really?
Across all disciplines. Even when you look at newer disciplines like histopathology, which is again ripe for digitization because it involves pattern recognition. Anything that involves pattern recognition is open for disruption.
Exactly. Yeah.
So a histopathology slide is just pattern recognition of tissue, or genomics, right? Which has so much data coming in that again, you need some assistance on being able to process that data. But all of that, the final phase or release of result still requires an expert to look at it and sign off appropriately.
Sure. There's this lady called Dr. Anita Borges who does cancer.
Right.
And she's literally the legend in everything cancer. So if you ever had a reason to have yourself tested, you always want her to sign the thing. In fact, she's one of those people I've reached out to see if she can come. But so are you telling me there are people like her in companies like yours?
Yes. So the amazing thing is with digitization now available to us, we can access people like that from any geography.
Got it.
Across Bombay, across India, across the globe. So if we look at histopathology, for example, which is her core domain of expertise, previously, if I wanted an expert opinion from any histopathology expert residing in the country, I had to physically send a block or slides for them to look at it under the microscope. Then they would type a report and send it back and ship the slides back to us. Today, digitization allows us to do whole slide imaging, where once these slides are ready, they can be digitized and distributed electronically to anyone, anywhere. And we do that. So we have 40 pathologists in the US that are on our panel as well, all divided by different subspecializations. For example, a kidney biopsy or a kidney pathology case would go to a renal pathologist. A head and neck pathology case would go to a head and neck pathologist. Similarly for lung, breast, prostate, colon, the list is endless. And that's where the sort of this marriage of digitization and hardware, AI and post-processing, and the expert analysis that still resides in the human mind, bringing all of that together makes the future of medicine so exciting.
Very interesting. So then let me ask you this. Obviously, one of the things as a patient I always worry about is a false positive, right? I don't have something, but for whatever reason, the result came back. And then God forbid, later on, I found out it wasn't really true. Does that really happen? Is it common? What can I do to?
So today's pathologists and radiologists are also very responsible and aware of the need to make sure that any positive result that's released is rechecked appropriately. In all good labs, not just ours, any laboratory positive result by default would be rechecked. If it's not fitting with the age profile, demographic profile, or the medical history of the patient, we will even do a redraw of that blood sample just to verify that the result is indeed correct. Sometimes, even without the patient knowing, if still we're not satisfied with the finding vis-a-vis the patient's profile, we will send that same sample to another lab to get it cross-verified at our cost to make sure that this result is indeed correct. And that applies for extreme cases where it's a very unusual finding that you wouldn't expect. So similarly in imaging, if we're doing an ultrasound and we find something that's suspicious, without even charging the patient, do a complementary MRI screening or a CT screening as required for that particular patient, or at least talk to the referring clinician and say, look, this is what we're suspecting, but here are one or two things that you can do to verify the result, right? And make sure that we're indeed on the right path. So a responsible service provider who is in good dialogue with the patient and with the referring clinician and has the ability to have those conversations. Sometimes what happens today, if you're getting samples from a wide geography, you have no direct connect with the patient or direct connect with the patient's clinician. And then it's very difficult to really ascertain, what to do with a positive result. And therefore it just gets released. But with the way we get our patients and samples, it's not too hard to have a conversation and make sure that what we're releasing is indeed correct. So I would say for us, the likelihood of a false positive going out is fairly low. We don't get pushback or patients coming back saying, look, you diagnosed this and
it's completely
I realized
whatever, something different.
There. A false negative is a more likely outcome. And again, sometimes it's just with all the tools we have at our disposal, all the bright minds that we have, something subtle can still get missed. And particularly if it's very early, depending on what technology you're using, who the interpreting radiologist or pathologist was. So you may still see some false negatives, but false positives are rare.
Interesting. Which brings me to the final question on this topic, which is this cost aspect, right? I don't want to run anyone down. And obviously there's no point in taking names. But as a consumer, I see someone offering me something at X price. I see someone else offering me something at 5X that same price. What's actually happening? Is it like really cheaper? Is it like, are you just, cutting corners? What are you really doing? And how can you offer something that, let's say I'm offering at like 1,000 rupees, or someone else is saying, okay, I'll come do it for 100. What's really happening there?
Well, like I mentioned a little bit earlier, this industry is open to economies of scale and does give you cost benefits with large volume of testing. But to reach that kind of cost benefit, where you can bring down price to such a low level and still maintain your quality, you need to be getting in millions of samples from a wide geography. And the moment you do that, while your analytical costs come down, your pre-analytical controls go for a toss.
Of course, absolutely.
And that affects your results. So I actually think that being too aggressive on costs and pitching that as a differentiator at some point comes back to haunt you. Because two outcomes may happen. Either a patient may get tempted and say, look, all these years I've been paying a higher amount. I'm potentially being taken for a ride. The actual cost is much lower. A good brand is offering me something much cheaper. I should try it. But when that happens, over a period of time, we've seen people come back to the incumbent where they were testing before. Clearly, something's going wrong there in the testing process. Or you may get patients saying that I don't trust this quality. It's impossible that a test that I was paying for X amount so many years is now available at 1/10 of X. So some consumers naturally just won't test at that price, thinking that, that sort of a reverse psychology at play, saying that these tests cannot be dependable.
Yeah, exactly.
How is this possible?
Yeah, exactly.
The truth lies somewhere in between. Clearly this industry has good margins when you look at it from an operating EBITDA standpoint. And that's true of, you can look at numbers for publicly traded chains and that's evident. But there are many fixed costs that the end consumer doesn't see. For example, in our setups where we typically use 5,000-7,000 square feet of space in prime areas of a city like Bombay or Pune or Bangalore, where rentals are very high, power expenses are high, we don't really get significant benefits in any kind of subsidies for healthcare from the government. The fixed cost structure tends to be what pulls you down. And those are not seen by the patient, right? They see typically the cost of running a test or the cost of doing a test on ultrasound or an MRI, where the operating margins are very high. But the moment you account for those fixed costs over a period of time, and then you look at longevity, right? Where we're not a fly-by-night service provider. So you look at longevity, you'll find that when those fixed costs are actually accounted for and profit becomes, consideration, which it should for all businesses, right? Like healthcare. Healthcare is like any other business where at some point, sure, we want to do good for the patient. Patient is always first. But it is important that whoever is providing the service must eventually be able to sustain that service. So when you look at longevity, we find that there is a price rationalization, which we've already reached. The last thing I'll say on that is, if you look at pricing in India, what has traditionally been existing before this low-cost disruption that came in the last few years, we are still among the lowest priced healthcare markets in the world, using the best technology, the best machines, having the brightest minds. Indian doctors are coveted all over the world. So with all of that, if you compare us to any other developing market, forget developed market, we are still very, very low in terms of our pricing. So that's perhaps one way to look at it and understand that what we're offering is quite fair.
No, and then I think at the end, this is about health, right? Like you don't really want to do cheap when it comes to health. Right? You want, who doesn't want the best when it comes to health? So
yes.
Let's shift topics. Let's talk about home testing. So I know it's not very common in India, but in the US and other countries, people just send you a kit home and then you get yourself tested for all kinds of things, right? Blood, genes, etc., etc., etc. Is that happening? Is that something that will happen in India?
So the home testing market for blood testing is quite large, where a phlebotomist will go home and draw the blood. So it's not self-testing, but there is a well-developed home testing market that's actually not available in the rest of the world. So one of the reasons why they have to develop self-testing platforms is because there's no option of sending phlebotomists home for blood draws or a technician home for a home X-ray or a home ECG and all of that, which is very easily available in India. The home testing market will continue to grow. At the end of the day, who doesn't value convenience and time?
Correct.
Right? So even if it's at a bit of a premium, I don't see that being a challenge, and we expect that volume to continue to explode in coming years. We haven't seen a lot of movement in self-testing kits. There's a little bit of work being done on self-pap smear testing to expand the cervical cancer screening market, right? Which typically one of the factors that constrains women from testing more is having to go to a facility and then a gynecologist performing a smear. The hypothesis is that women may find it more comfortable to do it at home and be able to send their kits in. Home genetic tests are available, saliva-based tests. Those are available in India. But again, our understanding in our laboratories from our scientists is that if we're able to get a serum draw, our ability to perform those tests is better and the quality of the results are more dependable. So we prefer a serum test over a saliva test today when it comes to genetic screening. And we are seeing some evolution in point-of-care testing, right? But again, these would require a phlebotomist to be available and draw blood. There's no self-finger prick testing or any other mode of collection that can allow patients to do it. So we haven't seen as much of it in India yet. And I don't think it will come in as large a way as it is coming in the rest of the world because of the availability of resources to be able to test at home with experts.
It just makes so much more sense. I mean, if I can have someone come and draw, why would I try an experiment on myself?
Right.
Continuing on this topic, so obviously a lot of these things have also now started coming around, right? So like a continuous glucose monitor.
Right.
I put the patch on my arm. Ben was on the show recently. He showed me like a blood pressure monitor, which is new. He put it on your wrist. And then whenever you're at rest, it quickly takes like a blood pressure sample. Are things like that now also beginning to sort of, in some sense, affect what you're doing? Or are they correct? Are they accurate? Would you recommend a CGM versus like coming into your lab?
Excellent question. I do think that wearables and remote monitoring of health is the future. There's no question about it. While in the short term, it may be a little bit of a threat to the traditional diagnostic businesses. In the long run, we're all going to have to embrace it as something that actually supplements and adds value to what we're doing.
Correct.
Particularly, again, when you look at it from a preventive healthcare and a monitoring standpoint. I'm not sure a CGM for a per se healthy individual is required, but for someone who is diabetic, sure, it's a great addition. We see a lot of diabetologists now recommending a CGM. The results are reliable, accurate. I don't see a challenge with that. Cost is a challenge, right? So for this to really penetrate at scale and to go beyond you and me to, let's say, across the country, there's going to have to be significant cost rationalization in these wearable devices, right? Or monitoring devices. Whether it be for sugar, blood pressure, dyslipidemia, and so on. The other challenge is what tends to happen typically with the end consumer in particular is when you wear these devices, initially there's a lot of excitement around it and you'll check it every day and you'll follow the information, you'll take some action based on the results. But over a period of time, you kind of tend to get bored with it. There tends to be fatigue around it. So the incremental value of it over a period of time tends to wear out. If this is connected to your clinician and service provider, where on a regular basis, they can be in touch with you to monitor and give you insights and tell you what to do with these results, then it's great. But if you're doing it just out of your interest, after a period of time, the novelty factor will wear out.
Sure. So let me talk about myself. I'm someone who loves testing. And I think what I found very interesting was the sort of, in some sense, the difference between taking a snapshot, and sometimes, that's all you need,
right,
but also in some sense getting continuous data, right? So I wear like a watch. I've tried the Whoop, I've tried the Aura. I have a strap which I measure my HRV on. And so I have a whole lot of data. And what I find very interesting is like being able to see changes over time and then in some sense correlating it to my life. So I had a stressful January, and then so here's what happened. I had, a wonderful February, and here's what happened. So I love it. I'm someone who really, sort of enjoys this. I think there's a thing to be done, but I think I do appreciate the fact that it's expensive. This is not something that everyone at this juncture can afford. But the direction is going there is kind of what you're trying to say. Okay, wonderful. So do you see a lot of this data that's coming out of the Garmin and the Aura and the Whoop and so on and so forth playing back into your database in some way, like maybe helping you understand the customer better, maybe making better predictions, using big data, AI, whatever? Is that happening at all?
Not yet. And that's a logical step in which this should move. We're very excited about being able to do that and have that information being available to us. I see three challenges. One, connecting that data to our healthcare IT or healthcare systems. And when I say ours, I mean across the board with healthcare providers in India is a challenge. Given how powerful India is on IT, India's healthcare IT should be, or the adoption of digitization in healthcare should be the highest in the world. We should be leading that movement, but we're real laggards. For whatever reason, the digitization of healthcare as compared to any other industry in India has sort of lagged far behind. So that needs to change. For this data to really be meaningful, it has to be able to integrate and come into legacy healthcare systems that various service providers are using in India. The second challenge is, what do you do with this data? It's very difficult to put human beings or doctors on the job to look at data, manually sort through it, connect it to the patient and make sense of it and then give actionable insights. So until we can find AI or big data solutions that can help us quickly synthesize and give real-time updates or feedback to the patient, it doesn't become so useful. And the third thing, like I said, is cost. All of this is going to cost money if we're really going to do it at scale, unless insurance companies or corporates subscribe to it in a large way and take it up to create a healthier workforce or a healthier patient base within the insurance company. We're not going to see large scale adoption. And, we don't want this to just exist at a very niche level where a handful of people do it out of interest or because someone has pushed them to do it. If you really want to have impact at a community level, a community health improves across the board, then someone's going to have to pick up the tab on it.
Sure. Do you see NM in my home? Like is the future like you're constantly testing me at home? You have everything integrated into my home in some sense. You're not only monitoring my vitals, you're also monitoring my home. So VOCs, toxic materials, etc. Is that like something that you would dream of?
Sure. We've always thought about how to solve for the challenge of the air quality that we have. And while, today a standard response is to put an air purifier at home or in your office, there are companies globally that are working on better solutions.
Right.
So that's one clear area that at some point we'd like to move into and have some play in, because I do think that a healthy you involves you breathing healthy air.
Of course.
So whatever we can do on that front. In terms of being more interconnected at home, like I said, sleep is one area that we will have a significant play in. Wearables and monitoring and having access to that data is something that will naturally come in years to be. And then who knows, when all of that is actually coming in, how we can play a more central role integrating with the Alexas or so whatever devices you have at home.
Sure.
Is something that one can look at. That's how this whole sort of diagnostic and screening play should evolve.
Yeah.
So that people feel more involved and more in control of their health.
Yeah, sure. And then that is true prevention also, right? Like real-time monitoring, real-time action, real-time prevention in some sense. Okay, let me change topics. I've been to your women's center. I was not allowed in. I did go to the reception and then they took me and they showed me whatever they could. Absolutely fascinating. I was so impressed. It's a center run only by women, for women, where they can go and get themselves tested. What was very luxurious sort of environment. Where what I was told is that the experience is very unique. The experience is very different. So multiple questions. First, why women? Why this center? And what is it that you're really doing? And why should all women come and sort of use your center?
Sure. So the brand is called NM Eva Health. And we've now got NM-EVA available at multiple locations. All the new centers that we're building has a dedicated floor for women under the EVA concept. And the idea being that, again, going back to what we spoke earlier, there's a lot of reluctance for people to test regularly, right? And while that's changing, there's still significant pushback. We found that the greatest pushback came from women. And one of the prime reasons for it was when they went to a typical facility for their preventive screening, whether it be at NM or at a hospital or any of the other providers that they may be using, they would find it to be crowded, not private. They would need to share their medical history in front of other people who are sitting in the same area. If you change into a gown, you didn't get the privacy. And after every test, you would need to change back into your clothes, then again into a gown when you went to different departments. There wasn't a focus on women's health. So you were pushed to do a general health screening program that didn't necessarily focus on women's health issues, what we know today to be of pressing importance. And the overall atmosphere just didn't encourage you to adopt preventive health. So you would go out of need if you needed to get a test
Compulsion,
done.
yeah, sure.
But it never encouraged you to take charge of your health and go for your screening. Now, that's a problem because what we've also understood over our years of preventive screening is that the woman member of the household is the one who can push the rest of the members to go and get their health checks done.
Yeah.
So if the wife or the mother has done it, she will push the husband, she will nag the children that, now this weekend, instead of going to Lonavala or
whatever,
going out, take 4 hours out and go get a health check done.
Sure.
So it is very important in our minds to convince a woman and to get this reluctance away from their minds of doing their health checks. Because if we did that, we know that they will convince the rest of the family to go in for their preventive screenings as well. So that's what led to the evolution of EVA. It's a center or a space for women, by women. We have female doctors, technicians, staff, completely private, very exclusive. We restrict the number of women that we take so that it doesn't feel crowded in any way. Women are comfortable to share their medical history, their concerns. They meet female healthcare experts who can guide them and counsel them through their primary health concerns. Even if they have a doctor or a gynecologist they go to, this is a supplement for them where they can talk more freely, particularly around lifestyle and health-related issues. The packages that we offer range from adolescence to old age, covering the entire spectrum of life. They cover a variety of health conditions in a woman's life, including pregnancy.
Sure.
So we have a pregnancy-focused package. We want people who go in for their pregnancy test to find it to be a pleasure and not something that they don't look forward to, right? Over the years, we hear so many stories of women going to centers for their scans and having to wait 1 or 2 hours even when they're pregnant. Here, when they come, everything is well set for them. They walk in, walk out. The radiologist can spend enough time with them, showing them the images that the mother is going to remember for the rest of her life. And similarly, when we talk of other women, health events that take place in a woman's life, whether it be post-menopause, where osteoporosis becomes a greater concern, whether it be cancer screening, like I said, for cervical cancer, breast cancer, ovarian cancer, that's a major area of focus now in India as well. We want to be able to do it in a way where women will embrace it and not shy away from it.
Got it.
And that's what we've been able to achieve. It's been tremendously successful based on the feedback that we've got from women who say that this is transformative.
Right.
And they now don't mind coming in for their health checks, and they encourage a lot of their friends and family to come in and experience EVA and understand how wonderful it then becomes to get your health check done. Of course, we add on some nice benefits of a spa-like experience, a nice breakfast. So all of those elements are just to make sure that when you're there for your health check, you're in a more relaxed frame of mind.
Got it.
And that allows you to open up and share your medical information far more freely.
And just for my understanding, then this is a full spectrum, like whatever a woman would need to test for.
That's correct.
She can come in there and get herself tested.
That's correct.
Fascinating. Okay. Talk to me a little bit about a particular condition among women, which is perimenopause. So we're starting to see women in their late 30s, early 40s starting to perimenopause. In your understanding, is there something you can do to test, learn, understand, and then solve?
To prevent...
let's say at least reduce the symptoms, if not like completely eliminate. So how would you first know women get symptoms? They don't really understand what those symptoms imply. So can I go in there, get myself tested, understand that, yes, okay, there is some hormonal flux. So maybe that's indicative of the fact that I am perhaps going through perimenopause.
Right.
Because I understand it can even run for like 10 years.
Yes.
So just talk me through that. Obviously, I'm not the expert. I'd love to hear from you. Thank you for watching. Being connected to each other is easily one of the most powerful emotions a human being can feel. On that note, I have a very small request to make of you. Lots of you watch this channel, but not all of you subscribe to this channel. If you subscribe, you'll get notified of all the new episodes that we're going to be releasing very shortly. We've had some fascinating conversations with some amazing people who have so many powerful lessons to teach. So please do subscribe. If you subscribe to the channel, you will know about all the new episodes we're releasing. So please subscribe now.
Yeah, not a core area of expertise for me either. And typically, what happens at least in urban cities in India, is a gynecologist plays a very important role in guiding the woman on what to test when it comes to menopause, because you're obviously having conversations with your gynecologist or at least your family physician on symptoms that you're likely to experience or when you start experiencing these symptoms. And typically the tests that you would end up doing are a series of, exactly like you said, a series of hormonal blood tests that can allow you to assess where you stand. What we focus on is, as soon as menopause hits and you're in a postmenopausal phase, suddenly your risk for certain medical conditions goes up significantly.
Of course, absolutely.
And therefore, screening for that, particularly osteoporosis, is something that becomes super critical.
Sure.
So that's our focus area. We don't like to get too much into the area of guiding women on what to test when at a premenopausal stage, because it's kind of getting into the territory of what gynecologists can advise them on.
Got it.
And they can do it in a better way.
And just sorry for my understanding, the osteoporosis is a DEXA scan.
Is a DEXA
You
scan.
do a DEXA scan. Okay.
Yes.
Okay, interesting. Okay. Next question, mammograms. So, I read a lot. And one of the things I keep reading about is this conflict in some sense about the need to versus like you'd be a complete idiot to go get yourself tested. Where are you on this? Like, do you think it's necessary? Should a woman actually get herself tested?
Start that answer by saying that we've probably saved a few thousand lives by picking up breast cancer early on a mammogram, where post the mammogram, the patient was biopsied, low-grade cancer was found, an oncologist intervened, and the patient has lived for many years thereafter. And equally, you'll hear of so many stories of high-grade aggressive breast cancer being detected at a stage where it's very difficult to then intervene and have any kind of meaningful quality of life for that woman. So mammograms are essential. And if you look at global evidence, the overwhelming conclusion is that the benefits outweigh the risks.
Mm-hmm.
Yes, there's an element of radiation in your screening mammogram, but with newer machines, newer technology, 3D mammograms that a lot of good facilities now use, we're able to bring that down significantly.
Sure.
It's important to know when to test, when to begin testing, and then how frequently to follow up. And our recommendations, in line with global recommendations, are typically you begin at the age of 40, unless you are high risk. And I define high risk previously as someone who has a first-grade relative detected with breast cancer, in which case you may start your mammograms between the age of 35 to 40. But you typically begin at 40. And then if your mammogram is normal, we recommend an annual or at least once every 2 years follow-up as a screening modality. If there is a intermediate finding, then typically you would follow up within a 6 to 12 month period. And if there is a positive finding, then there is an intervention that you would have, like a biopsy, to confirm that finding and plan treatment. If you look at all large healthcare providers in India, that's the guideline that's being followed. Now, sometimes we get patients coming in and having questions on exactly what you asked about.
Like,
radiation.
why would I exactly?
And then we tell them that the amount of radiation is actually no more than what you're exposed to naturally in the course of a year, right? When you're talking on the cell phone, when, there's so many other activities that you perform in your life that cause radiation exposure. A mammogram doesn't add significant additional radiation. As long as you're doing it at a good facility that knows how to use the machine, that's using good technology, and that won't over-radiate you or repeat exposures unnecessarily.
And then if you remember, you'd also talked about the magnetic scans, right? So could that be a replacement?
Yes. So there is something that we do on MRI called an MR mammogram or a breast MRI.
Okay.
But typically that doesn't replace a mammogram, A, because of accessibility. You will have mammogram far more accessible than an MRI. B, cost. It's much more expensive to get a breast MRI than to get a mammogram done. And C, the need for contrast injection. On a screening mammogram, I don't need to inject contrast. On a breast MRI, I need to inject contrast.
I see. Okay.
So therefore, MRI or MR mammogram typically gets used as a problem-solving tool. I do a mammogram, I do a breast ultrasound. I'm not able to clearly characterize the lesion. I will use a breast MR as a problem-solving tool, or for me to see the extent of disease. Sometimes you have multifocal disease with multiple lesions in the breast. A mammogram or an ultrasound may miss some of those lesions. So an MR will allow you to identify those cases more accurately. Or you may use it as a pre-biopsy planning tool. But it's unlikely to replace the traditional film screen mammogram or a digital mammogram as a preventive screening tool.
Interesting. Let's move to advanced testing. So, I think obviously one of the cool things or exciting things that's come out is genetic testing. And obviously I'm not an expert, and that's why I'm really keen to understand this from you. To my limited understanding, genetics obviously needs a pool of genes to have already been tested. You build a library around that, and then you use that to interpret my findings, right? So you take my whatever sample, and then you compare it to whatever you've already learned in the past. Is there a library for India already? Is that like well discovered, well researched, well understood, such that when you took my gene sample, you could interpret that to say, whatever it is that you're trying to interpret and say? Is that already there?
Yeah, so there are two parts to genetic testing. One is the diagnostic and therapeutic monitoring piece, and the other is a preventive screening piece.
Sure.
When it comes to diagnostic and therapeutic monitoring, genetic testing has made significant strides and is a very powerful tool driving this era of personalized medicine. So, for the two different patients diagnosed with breast cancer or a similar type of breast cancer, the way they respond to treatment would be very different.
Okay.
And that's entirely a function of their genetic makeup. So, increasingly in oncology, reproductive health, diagnostic therapeutic areas where treatment is involved, we're seeing genetic tests being adopted in a larger manner, cost being an inhibitor again, and availability being an inhibitor. But those are areas that will get rationalized over a period of time.
Yeah.
But it's rare today for an oncologist to treat cancer without doing a genetic test to understand what chemotherapy drug would be most appropriate for you. And there are enough India as well as global reference databases available to guide that treatment selection. But when it comes to the preventive screening side, where one may want to know what is my hereditary risk for lifestyle disease, what is my hereditary risk for cancer, based on my genetic makeup, how well do I respond to different types of food, or how well do I respond to different types of aerobic exercise? Should I focus on aerobic exercise, anaerobic exercise? All of that is theoretically very exciting and promising and can potentially be life-changing for you to have that information, and take proactive steps to maximize what you should do and shouldn't do based on those results. We just don't have enough data on the Indian population yet to rely on those results and really see significant actionable outcomes. There are a bunch of companies we offer it to where this testing is done on a microarray platform from a blood sample or a saliva sample. And you get a report spanning a few 100 pages, letting you know for everything in your body from head to toe, every gene that's analyzed, what that means for you from a disease and a lifestyle standpoint. But when you do it at two different labs, you may not get the same result.
Sure.
So today, those results are hard to rely on. I do think that they will become an increasingly important part of our preventive screening program once we have more valid data that can be depended on as a reference database.
Sure.
The other challenge is today, this analysis takes a long time. So we have people coming in for a preventive health check where they'll get all their results on the same day. But the genetic testing requires for me to be able to pool samples to be able to do it at a reasonable cost. So I won't be able to give a result for 4 to 6 weeks. That's a long time for someone to wait after getting a health check done at a preventive level. So that slows down the adoption of genomics in a preventive setting as well. One area that I'm quite excited about is, which every layperson can also do, is pharmacogenomics.
Okay.
So you essentially carry a medicine map in your mobile phone and you don't need to repeat it very frequently. So even if you do it one time, you know how your body responds to common drugs that you're likely to be put on through the course of your life. It could be warfarin, statins, whatever, clopidogrel, whatever it may be. And tomorrow, whenever that need comes for you to take any of those drugs, if your treating clinician knows genetically how well you are likely to respond to that drug, there'll be no trial and error around it, right? You don't play around with dose. Sometimes your body doesn't respond to those drugs. The clinician will increase the dose. Still, it doesn't respond. So you waste a lot of time, money in that process. You don't, respond adequately to the disease and your condition worsens. Pharmacogenomics is something that I see a lot of potential for, and we're already seeing some promising results on that front in India itself.
Sure. But sorry, just to go back to what you were saying earlier. So what I understood is that the science is there, it's just that the data for Indians is not there.
That's correct.
And that's just a function of time then. Sooner or later, the data will come.
The quality of bioinformatics in India is excellent, and a lot of global genomic science is being driven by Indians anyway.
Mm-hmm. So if I could summarize, what we've discussed, the marriage of, let's say, wearable data plus the diagnostic data plus the genomics data, the symptoms of the human being together, in many ways is going to be prevention. And that's kind of the direction that you guys are going into.
Absolutely. And you kept using the word data there.
Yeah.
So whoever gets that right in terms of being able to amalgamate data from so many different sources and in a time-bound and cost-efficient manner give a meaningful end result or output is essentially going to master this game.
Okay. So let's come back full circle. We started this conversation with prevention. And of course, we ran the gamut of like the different kinds of diagnostics for women, for children, for older people. But ultimately, prevention is also about lifestyle. You're very fit, right? You live a good lifestyle. Talk us through that, like as someone who actually does the diagnostics Diagnostics. What is your recommendation for lifestyle, exercise, food, nutrition, sleep, whatever?
I'm really happy that today we're in an era where in India also there is so much awareness about healthy living, healthy eating, exercise, a lot more emphasis from schools for children as well on adopting exercise and sports. It is so critical. We talk about all these tests, we talk about interventions based on these tests, we talk about interpreting results, but all of that is secondary to what you are doing to your body day in and day out.
Sure.
And like a well-known physician, once told me in a talk or mentioned to us in a talk, if you've been to school, you were exercising, you were playing a sport, and then you stopped for whatever reason, at let's say the age of 25, 30, and then today you are 70. And every year, by not exercising or not taking care of what you eat, even if you put on half a kilo or 1 kilo a year, think about the impact it has on your body over a 30 or a 40-year period.
Sure.
And that's how typically people put on weight or age prematurely because of the neglect. There's so much evidence now globally, and we see articles from all authorities. You read about it in the New York Times, any blog, social media posts about focusing on your core and having or embracing strength training into your workout. Having a workout regimen in the first place.
Sure, of course.
Some form of movement, some form of activity through the course of the day, particularly post meals, adds a lot of quality years to your life. We're talking about extending life in a quality manner, right? So adds a lot of quality to your life and reduces the likelihood of getting disease and therefore the need for sickness-based testing. Once you decide that you're going to add some form of movement to your life, having a good mix of strength training, balance programs where you work on improving your balance and muscle strength, flexibility, and some cardio. If you can bring that in with 20, 30 minutes even every day, I think you're going a long way in reducing your chances of becoming sick and living a healthy life in the long run. Diet is equally important, and I've read an amazing book recently that talks about eating in the right order.
Mm-hmm.
It's not that hard with the kind of food and the variety of food that's available in the Indian context or in an Indian household. Eating in the right order, ensuring that your fiber goes in first, followed by protein, then any carbs, and if at all any sugar thereafter, can be life transforming. So you don't necessarily need to reduce the intake of your food or the amount of food that you're consuming. You just change the order in which you eat, and that's not so difficult to do.
Sure.
So if people take a little more interest in adding exercise, following a little bit of the right mantra in the way you eat, you'll really complete the entire circle of preventive healthcare. Just going in for an annual checkup and then saying that's
I'm
done.
done. Exactly. It's
done.
a tick box.
And then in the remaining, interim 12 months, not paying any attention to your own health isn't going to do the trick.
Sure. No, and in fact, there's something I really worry about. Like, I'll give you a personal example. I was at the gym this morning and it was empty. I went at 6, I left at 7. It was completely empty. There was not a single person there. I went in yesterday. There were only 2 people, both foreigners. So I think this whole adoption of exercise is a integral part of the way you live. I think for Indians in particular, especially the urban Indians, I think, people in Bombay are sitting in a car in the morning, going to work, come back at night. You just basically don't get time. I think that's something that really needs to change. No, I completely agree with you. Wonderful. No, this has been so fascinating speaking to you. I could go on for hours. There's so much to learn, but I'm really grateful for you to have come. I'm sure we'll call you back again on the show. I've learned a lot. I know the people watching will take away a lot from this conversation. Thank you for coming. Really appreciate it.
Thank you for having me.